One of the concerns many parents have is whether their children might have ADD or ADHD or some sort of learning disability. With us today, we have Mrs. Bertha Guzman, who's going to discuss some of the different topics and ways to identify any types of special needs that your child might have and that you might be able to make a difference with them in their learning. With that, I'd like to introduce Mrs. Bertha Guzman. Can you tell us a little bit about the signs and programs that kind of identify ADD and ADHD for families?
Well, there are two areas that parents need to be concerned with. First of all, as a young child, parents need to ask themselves several questions. Number one, is my child behaving pretty much like other children when they attend an activity, like a party? Is he isolating himself when he's at a family gathering? Is he, when he goes to a friend's party, is he kicking and fighting and overreacting in that party? Children do that, so don't panic yet. But if he's doing that all the time, and you get into a point where you're saying, maybe we shouldn't go to that party because little Joe or little Johnny or little Susie is continuously behaving that way, that maybe perhaps those friends and those family members don't want your child there anymore, and your child is 2 or 3 years old, and you're saying to yourself, I'm wondering what's happening. Well, you're going to find out that these are some things that you need to begin to look for. Number one, childs that have an A.D.D, which is Attention Deficit Disorder, happen to have children that are sensitive to their environment. Okay, what does that mean? It means, mommy and daddy, that they have this environmental issues that they can't be around, they can't focus. Some of these kids will do this. They'll cover their ears because the sound's too loud. They'll cover their nose because they're very offensive to smells. They don't like other kids to touch them, okay? They have a tendency to do that. They are constantly, if you ask them, you're talking to them, Joe, come here, Joe, come here, Joe, come here, Joe, come here, Joe, come here. Joe, please come here. The child does not respond to you. And you're honestly asking him, please. And you have to walk to the child to ask him to come to you. And still the child does not come to you. He's continuously distracted, okay? The results is that he will then throw a tantrum, stubbornness. He begins to crunch and say no, 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 and throws himself on the floor, okay? Those are beginning signs to tell you that there is something wrong. Now, if it happens once, it's okay.
He's testing boundaries, is what you're saying.
Yeah, that's all.
If it's just once or twice.
You know, you may have him a little spoiled. And we do. As grandparents, you and I know we do that.
Right.
And, you know, sometimes we need to be a little tough with our children and say, okay, enough is enough. But if this is continuously repeating itself and there's a pattern, you need to begin to worry, okay? And then, honestly, your child is beginning to not to understand what's happening around him, okay? So when he enters the school site, whether it's a preschool or a kindergarten setting, depending on what you opt to do, whether to send him to a preschool program or you wait till kindergarten, there's where the teacher begins to say to you, he's not listening, he's not paying attention, he is throwing tantrums, he can't, you know,
can't focus
on anything. He does not do his task. He doesn't want to do anything. So that is signs of attention disorder.
There's a big difference for some families when we're talking about that, because so many times being, say, an only child and working at home when you could play when you want to play, watch TV when you want TV, eat when you want to eat, that type of unstructured time, and going into a school and finding a structure, they might be resistant. That's not the same thing as what we're talking about.
You have to be careful, because one of the options you have to remember is that you must work with the school administrator, a teacher, educator, and give your child that time to adjust to the school setting. So don't be overreacting, quote unquote, that your child is having, oh, my child has A.D.D. No, on the contrary. One of the things of the solution is to wait and work with the educator on site, and don't be quick to assess and tag your child. Greenspan recommends that you take time to make sure that the child has this disorder, that there is testing done, that there is evaluations done. The other part of it is that you have the direct opposite, which is you have this child that has, the touch and sound issue. Then you have this child that has, he can't sit, he's always standing, he's always, on his, he's always bumping into kids, he's always running around, he's constantly, if he's in line, he's causing a chaos in line, he's pushing the kid behind him, pushing the kid in front of him. Everywhere you find Jose, there is always noise and problems. Jose is. If Jose is in another classroom, he's causing a problem. If Jose is in another setting in the office and he's sitting waiting for his mother to pick him up, there seems to be a chaos in Jose. Everywhere Jose is, there's a problem because he is hyperactive. So this child has hyperactivity, which is a disorder that includes hyperactivity issues. So this is a child that seeks, because he is under what I call insensitive, he seeks sensitivity. His body needs a touch, needs the sensitivity of wanting to be touched. So he seeks that out. He wants the feel of touch. He wants the feel of wanting to be hugged.
And most children don't understand that, and it's the reactions. And so that idea of personal space, he has no idea
whatsoever
of what that is. And as a result, that's where the chaos begins to occur. And again, it's not that once in a while activity, but it seems to be on the constant motion, whether it be in a small group or in a large group, in line. If there's always that type of activity, that may be a warning sign that he may have A.D.H.D.
Right. And it's like Greenspan describes him. He is like a one-man band. He's always making a lot of noise because he needs that sensitive issues of touching and feeling. He's always, so you hear a little girl says, Jose's touching me, he's bugging me, he's always touching my head, he's touching my arm, he's blah, 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 blah. So if you have a child like that is constantly looking for that touchy feeling kind of thing, that's what you might be having.
And that's not a discipline issue.
No.
That's a learning issue.
A learning issue.
Which is very different. And it's sometimes it's misinterpreted by parents and sometimes teachers if they're not sensitive to what to look for.
Exactly.
So when we're talking about all of these things that you're seeing with your child, in terms of making the decision of do they have A.D.H.D. or is it something else, what would you recommend a parent doing?
Well, the first thing I recommend is don't panic. Okay, please, parents, don't panic. Just, sit back. Please, 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 please. Do calmly observe your child. Take some notes. Be very open-minded to what's going on. It may be a growing spurt the child's going through, and you may overreact. Number two, if those behaviors continue to persist, go to your medical doctor and explain to your doctor, this is what's going on, this is what I'm seeing, I'm not too sure what I'm seeing, you're the expert, tell me, you're the pediatrician, give me some advice. Third, one of the advices that people are given is be careful not to put your child on medication so young, unless it's absolutely necessary. There are lots of medications out there for a child, but we ask that your doctor will tell you which route to go.
So it's really important then is the communication between the school, the parents, and the physician, if need be,
If need to be.
to be able to compare notes, to see is he behaving that way with you but not with the teacher, is another indication of it may not be ADD or ADHD. But if it's consistent from parent to teacher to other activities, then that may be the concern where you'd want to get the doctor involved.
And always compare that. Compare parent behavior, teacher behavior, school behavior, grandma's home behavior. Remember, he goes to grandma's house, or babysitter's behavior. All those are different environments that a child is in. Compare all of those and see how he's behaving. It may be that you may have a spoiled little boy or a spoiled little girl. So take time to review and be patient with your child before you make any drastic decisions when it comes to your baby, because they are precious and we want the best for your child.
Thank you very much.
You're welcome.
Join us next time as we talk about a variety of different things in learning, in health, and in activities that's going to make your job as a parent a little bit easier and for your children to be that much happier. Thank you very much.